is an ISO-certified Greek-registered international NGO affiliated to Cheer USA. With a mission of providing people with the knowledge and ability to create healthy, thriving communities, Cheer International Group has brought hope and dignity to multitudes. I have Anne Merewood today on Chezuba Talks to tell us more about Cheering Greece. Dr. Merewood is a founding member and a public health specialist with 25 years' experience running maternal child health programs. She has worked internationally and is well established in the field. Welcome to Chezuba Talks, Annie.
Thank you.
A pleasure to have you on this episode. And I'd like to thank Stamatis of GiveMed, who referred this wonderful organization to me to get you on the podcast. So I'd like to know, how does Cheering collaborate with Cheer in the USA, and what are the key benefits of this partnership for your organization?
So Cheer in the US is based at Boston University, and we work and have worked for 25 years with different populations, definitely with marginalized populations. We've done a lot of work with American Indians. We've done a lot of work with African Americans in the South. We currently have a big grant from the CDC working with 101 hospitals across the US from Puerto Rico to Guam to improve maternal child health practices in the hospital. So I personally have always worked with a goal of making things better for underrepresented groups. And I spent a long time doing this. And then finally, I was thinking, what about some of the most underrepresented groups, which in my opinion is refugees? So there is a personal connection with Greece. I speak Greek. I have a home here. Part of my family is Greek. So I began working in Greece with Cheering in 2018. And that's basically a sort of adaptation of the Cheer program here, but it's adapted as it's gone along. I began it with the goal of doing breastfeeding and maternal child health, which has really always been my field, along with public health. But I have seen that the need here is far greater than just for breastfeeding. Of course, we need breastfeeding support, but we work in the refugee camps, and for every 10 children who are breastfeeding, there are 1,000 between the ages of 1 and 18 who are not getting any help. So we have really broadened our spectrum of our scope to do more broad work, not just with small babies and mothers, although that remains one of our focuses.
For people listening to this podcast, if you could explain, when you talk about refugee mothers and infants and basically the vulnerable population, what kind of support they require, and how is Cheering helping out with these programs?
They don't have any support. I speak with other people, even incoming volunteers from European and US nations, and people ask, like, what interventions work? What do you know? They don't have support. There is very little here for them. And I don't think it's just Greece. I think other countries too, but my experience is based in Greece. So they need everything. So the kinds of things, we started out helping with nutrition and breastfeeding, and we have expanded. So the kinds of things we do, because we're public health people, is we give out head lice shampoos, worms medications, vitamins, high nutrient foods, fruits and vegetables. We have also 2 separate programs within this program. One of them we do it's called Vitamin Angels or Vitamin Angels in the US. It is I don't think it's actually a US based program, but they send out worms medications and high dose vitamin A, which we distribute and give. We don't just distribute it. We take the kids under the age of 5 and we give them the supplement, so pour it down their throats. Yeah, so that is Vitamin Angels. So they work internationally and they're working with Oz. And then the other program that we're doing is to do with iron supplementation, because we started to assess iron levels in our female population, women of childbearing age, some puberty through all age really. And we found that 64% of women were anemic. And in our teenage population, about 85% of girls were anemic. So we supplemented, we take supplements now, we oversee that, we retest them, we talk to them. The need is huge because we are seeing people from Afghanistan, Iran, Iraq, all of Africa, like all different African nations, Palestine, Syrian, people who speak every different language. And we have translators, volunteer or poorly paid translators in Arabic, Farsi, Kurdish, And some of the main languages from the south of Africa, like Lingala, and French, colonial languages. But it's very difficult. We're treating a huge range of people, and they have no access to care. So I'm not going to name any of the camps where we work because we can't do things like that. But for example, most of the camps we've ever worked with, and we've worked with most of the camps we've worked with all the camps in Greater Athens, they only have one doctor for the camp. And sometimes we're working with camps with 3,500 people and there's one doctor. Right now, at this moment, I don't believe that our doctors, there's a contract that's run out somewhere. So I don't think there are any doctors in the camps. And what happens here in Greece is people send high-risk people to Athens area, or to the mainland. So people come to one of the island camps like Lesbos that people have probably heard of, and high-risk people like pregnant women or women with small infants or people with disabilities, autistic children, they get sent to Athens so that they are closer to services, but then they don't have any access. So, for example, one of the camps we're working at, it's about an hour and a half's drive out of Athens. To get to Athens, if you don't have a vehicle, you have to get a taxi or something to the station, which is already prohibitive. That's about 15 minutes. Then they have to take 2 trains into Athens. And we're talking maybe a woman who needs some kind of OB care, she's got an infection or something. She's got 3 children. She hasn't got any stroller. So she can't speak Greek or English. So how's she going to get into Athens to go to an appointment? They don't come here. They don't go to the camps. Very few NGOs. We're not allowed inside the camp. We used to be inside the camp. The Greek government has banned everyone from going in, but we have good relations with the camps that we serve, and they have letters set up in the parking lot. I don't want to demonize anybody. The individual people that work with us in the camps or from the camps, like the security guards, a real source of help and strength. So we don't have a problem with individuals, but the way the system is set up, access is probably the biggest problem for everybody, as it always is in international public health crises, which this is.
Right. I mean, I can see that there are huge challenges to help people, but you still do it, right? So, may I ask, what is it that motivates you and your team to keep going?
Well, I've been in this field a long time. I believe you can change things. I have to say that in the US, I've worked with systems like hospital systems, insurance companies, broad spectrum systems where you feel like you can influence a lot of people at once because you change something in the system and it brings about a change that impacts all the patients in 100 hospitals. However, in Greece, I don't feel like that. I don't feel like we're impacting people systemically. But I do feel like, the need is really urgent. Many of these people are not going to stay in Greece. When I speak to my colleagues who see refugees in their country of eventual destination, they say that mental health is the biggest single problem. I'm sure it's a huge problem here. We're just talking survival. We're talking like making sure your kid doesn't have head lice. Treating wounds, giving people antiseptic creams and cough medicines. And we do a huge amount of distribution of over-the-counter medicines. We can see on a daily basis that we are making people's lives better. And the same people come all over again. And some people may think refugee camps, they're there for a week or two. We've got kids that we've seen them grow up. There's one little girl from one of the camps. She was 7 and she's 13 now. She was 7 when she came to the camp. We started working with her, I don't know, about 5 years ago or something. And we've seen her change from a child to a teenager and her family. So it's not like these people are already able to move. So we believe in change, and we can see what we do. It's difficult for volunteers. You may want to use this for our infrastructure. I always direct programs with an emphasis on including the population. So actually 2 of our board members are former Afghan refugees who work with us all the time. And they help direct, the program, and they are really, really influential. And we also we pay the people that work with us from the community, we pay the translators because we don't believe in not doing so. But I will say we are definitely supported by a large number of volunteer young people who are either not paid or subsistence paid from their university or something to do internships. And they come, we prefer people with like a health background or nutrition, something that's relevant. And they come in for 3 months is our minimum, 6 months, some of them a year or 2 years even. And they help. So they are kind of running the programs. Like one of our young ladies who was from Spain, who just got in to do a master's somewhere else, she was with us for 6 months and she ran the Vitamin Angels project. So she was making sure that everything was, that the medicines were coming in, that they were catalogued, that we knew where they'd been given out, who'd got them, because you repeat them 3 months later. So she had that and she's writing the reports. That's one example. Another of our young ladies who was Swiss Canadian, she ran our anemia program. So she was working to keep the records to make sure that we know what kind of iron we're given to people, we were retesting people, etc. So it's motivating because everybody sees the need and we get a lot out of it. You get a lot of recognition, and not recognition. No, you don't get recognition. satisfaction. You get a lot of satisfaction. We did have Yes, a lot of satisfaction. We had a small program that was funded by Boston University Center on Forced Migration, just a small grant, which allowed us to do some focus groups. I mean, and the quotes from the focus groups are just soul destroying, really. But people said, "You are our voice. We want you to tell people. We are treated like animals. We need you to tell people that. You need to be our voice." And I feel like that's the kind of motivation that keeps us all going. And all these bright young people that come and work for us, they're all got big ideals, and it's good for them too. I mean, I've had a lot of medical students. I have a lot of people that come who've got masters or doing their masters in policy, migration studies, disaster management. Even with all the academic training they've had, there's nothing equates to what it looks like when you're on the ground. I had a young doctor. I had a young Muslim doctor from London who had done global health as 1 year of her specialty in global health. And she told me that she learned more with us in 6 weeks than she had learned in her specialty training for a year. And any specialty, we've had a medical student who was in a dermatology focus. You see everything, for better or worse, you see everything. We see scabies every week. We see all sorts of things that you don't even know what they are. We don't, it's not a common medical thing because people aren't being treated. So you see everything. We had one, we think the woman had a breast tumor, those kinds of things we cannot handle. I mean, we can tell them where to go, but they don't always get care. So that's the difficult part for the volunteers, especially the medical professionals, because we're not a medical NGO. We don't have licenses to practice medicine. We can't write prescriptions. So for the medics, it's very difficult because they could say, we'll give them antibiotics, but we don't have access to that. We have to, send a note to somebody to say this lady needs a prescription for antibiotics. And then when she gets it, she can't afford to pay for it. So we've ended up doing some programs around trying to pay for prescriptions.
Let's take a break to understand what Chezuba is. Everyone at some point ponders on how this beautiful life can be made more meaningful. Maybe you're a leader trying to enhance your employees' experience at your organization. Or you already work for the community and seek volunteers with state-of-the-art skills to strengthen your nonprofit. Whatever your situation, know that you can make a difference. Chezuba began with this very vision. A vision to facilitate every skill and every passion in the world in meeting a social need. Corporate volunteering has several benefits for both businesses and organizations. In parallel, experienced and enthusiastic volunteers join NGO workers, enabling them to serve the community more effectively. Chezuba offers everyone looking to add purpose and meaning to their lives a chance to connect or volunteer virtually with non-profit organizations from over 100 countries around the world. Visit www.chezuba.net and explore opportunities to find meaning. Chezuba, your platform to do good. And now, back with our guest.
So you're right, Annie. I understand the challenges. I can visualize what you are probably seeing every day, and it kind of challenges your conscience also, right? To see the way things are. On a lighter note, I do see on your website you have something called football camps. So
do you
run them?
That's a huge part of our program. So actually, I should have mentioned that. It's also health related. So that is funded by the FC Barcelona Foundation, like the footballers, all sports actually, the Barca Foundation. And that program brings in most of our funding. We have football teams for small children, young men, and we do practices in different camps. And also in Athens, we bring the children in on the train twice a week, and kids come from all over. We can have between 20 and 50 kids at a session, half of whom we have to bring on 2 trains from a camp. So it's quite intense. And one of my funniest stories is that we had a little boy who said to the volunteer who was bringing him, "I don't like football." And he's like, "So why are you coming?" He said, "Because I've never been on a train before. And I really like to go on a train with my friends." And it's just very nice to get out of the camp. They get out of the camp and they're like normal children for a few hours on a train, on a football field, playing with their friends. Some of them really like football and are quite good, and some of them just want to hang out, and that's fine. We also feed them. So all the kids that come to that training, we work with another NGO called Project Harmonia, and every week we pick up between 60 and 80 meals twice a week to feed the kids. So when the kids and the young men and the coaches from the community go home, they have a hot meal in packets to take with them. So we screen them for health. So Barca's big thing is health. So although it's football, it's not about becoming a football star. Others, some of the kids think it is, and that's a little bit sad because we're not got the kind of support that's going to turn them into the next Ronaldo. But Ronaldo doesn't play for
You're doing
Barcelona.
your bit.
Yeah. But the focus is on health. So, for example, we screen their kids in the football program a lot more rigorously than we screen at the camps. And the camp, it's a question of what can we treat? I mean, if we don't have enough worm medicine in stock that week, we can't ask everybody if they've got worms because we can't give it to them. So that's not right. So it's what can we treat? How can we do it? With the kids in football, we do a little bit more in depth. Every kid gets a cardiac screening every year. We refer many of the families to the dentist. I would say dental work is probably one of the biggest problems. You don't need to be a specialist. The kid opens their mouth and their teeth are black. They're not eating, they're not sleeping, they're unhappy. So we do a lot of referrals. So although football is kind of the way in, the health piece of it is what Barca's really interested in. And they've sent us a lot of medication, as well as GiveMed, which you mentioned before. I mean, GiveMed sends us we get a lot of free iron, especially from GiveMed, but a lot of other stuff as well, yeah. And we also collaborate with 2 or 3 other organisations that give us things like diapers in bulk, because people need all those things, diapers, sanitary pads, hygiene products like soaps and regular shampoos. We get those from warehouses. Blankets in winter. It snows in Greece in winter. People don't know that, but it does. It snows, and so people are very cold.
Yes. I'd like to tell people who are listening and watching this episode.
Well, please come help us. We need, if volunteers are interested, we have a 3-month minimum, and we need people who can manage. We don't want to be holding people's hands. They have to be able to manage, and they have to work really hard. There's a huge need in refugee situations. I would say that the populations are largely ignored or sidelined, and there's a great deal to do. So although we prefer health specialists, we also need strong people who can carry things around for us. People can be distributing things, people who can sit on the train with the children, people who speak different languages because we need translators for the languages in question. So that's the kind of need we have. And of course, we always need money. I mean, people overlook that because we have to pay our regular staff here, and that's really difficult. So, stuff, everyone likes to donate stuff like cans of tuna fish, but we actually need money to buy not tuna fish or not pork meatballs, which is one of the donations we got. Not pork meatballs. We don't. So we need that. But the other thing is, I would say, yes, it's difficult. I would say to the people who are in policy and going into the field, it's really difficult to understand what you're dealing with unless you're here, unless you go and experience it. I think all of our poor volunteers that come go into shock, especially this is Europe. We're not in South Sudan. We're in Europe, and we're a stone's throw from WHO in Geneva. And why is this being allowed to happen in Europe? And is it any better anywhere else in Europe? I don't know. But it's very bad here. And people shouldn't assume that because these refugees are living in a European community that they've been in any way integrated, managed, helped. Only about 20% of the children have documented vaccinations. Can you imagine? That's putting everyone at risk, not just them. Polio, where's polio vaccinations going? Frankly, where is WHO and UNICEF in this? Because I've consulted for them, and there's a lot of policy. But at the moment, they're not in the trenches. It's very, very difficult out here. Really difficult.
Well, Annie, thank you so much for talking to us and for the good work that you are doing. I hope you get the support and help you require. And thank you so much for sparing time from your busy schedule to talk to us.
Thank you.